Riley. I'm going to be your nurse today.
Hi, Riley.
I was given doctor's orders for a neuro assessment. Is that okay?
Yeah.
Alright. Can you verify your name and date of birth for me?
Yeah, my name is Ken Dean, and my date of birth is 1/28/1994.
Awesome. And at this point, I would assess my patient's level of consciousness using the Glasgow Coma scale. His eye opening is spontaneous, verbal response is oriented, and he obeys with commands for motor function. So, do you know what year it is?
Yeah, it's 2019.
And our president
It's Donald Trump.
Okay, so my patient is alert and oriented ×4. My patient's mood is stable and congruent with his condition. He's also dressed for the weather. I'm going to kind of test your memory real quick. If you can just repeat these after me.
Okay.
Or if you can, I'm going to say it, and then I want you to say it forward and backward.
Okay.
So 1, 2, 3, 4, 5, 6.
1, 2, 3, 4, 5, 6.
And say it backwards.
6, 5, 4, 3, 2, 1.
Okay, and what did you have for dinner tonight?
A sandwich.
Okay, and then where did you grow up?
In Tyler, Texas. Well, Dallas area.
Okay, so I am able to note that my patient's immediate, recent, and remote memory is normal, or there's no signs of dementia or Alzheimer's. So I'm going to have you get up real quick. And I didn't see you walk in, so I just want you to walk normally.
Oh, okay. Yeah. Do you need to walk in a straight
Oh
line?
no, just walk normal.
Okay.
Okay. Patient's gait is steady and smooth. You can come back. Have a seat. Alright. And actually, I'm going to have you perform the Romberg test.
Okay.
So I am going to have you stand up in front of me real quick.
Okay.
Face me. Close your eyes. And I want you to just stand with your feet apart like this. And I'm just testing your balance. Alright, yeah, the patient is able to balance normally. Okay, now I'm going to have you touch each of your fingers to your thumb for me, just like that. And go back and forth. And faster. A little bit faster. Good. Now I want you to touch your nose and then touch my finger as my finger moves, okay?
Okay.
Good. Patient upper and lower extremity coordinations are normal. So now I'm going to be checking for the cranial nerves to see if they're intact. So cranial nerve 1, we do that by scent. So I would get some coffee, lemon, or mint, and just slide it. You smell that?
Mm-hmm.
What is it?
Let's look a little bit like lemon.
Lemon?
Mm-hmm.
Awesome. Perfect. And then I would test cranial nerve 2, visual acuity. This is used with a Snellen chart. You stand 20 feet away and have the patient read the lines that they are able to read, followed by covering one eye, reading them with that eye, and then vice versa. And then I would check cranial nerves 3, 4, and 6. As I've said, my patient's pupils are equal and round just by looking at him. And I'm going to check for reaction to light. Look at my nose. Okay, they are reactive to light, and then I want you to follow this in. And they accommodate bilaterally. And then I'm also going to check the extraocular muscles. So I'm going to do the 6-field gaze for that. I want you to follow my finger, okay? Good. The extraocular muscles in the eyes, note that cranial nerves 3, 4, and 6 are intact. Now I'm going to test cranial nerve 7. I want you to smile, frown, and puff out your cheeks.
I don't know.
Good. Cranial nerve 7 is intact, except for all cranial nerves are intact. Now I would test cranial nerve 8 by hearing, so I'm going to perform the finger rub test. Okay, you can also perform the whisper test for this. For cranial nerves 9 and 10, I would test the gag reflex. We're not going to do that for this assessment, but I'm just going to say that he is able to swallow, and cranial nerves 9 and 10 are intact. Cranial nerve 11, I'm going to test the patient's ability to shrug against my resistance with your shoulders like this. Okay, awesome. And then I want you to go against my hand with your head, okay? Good. Good. Cranial nerve 11 is intact. And then for cranial nerve 12, I'm going to have you stick out your tongue. And I want you to press your tongue to your cheek right here so I can test the strength of it. Good, good. So now I'm going to test for muscle strength in your upper and lower extremities.
Okay.
I want you to push up against my hands.
Okay, like this?
Yeah.
Okay.
Good. And again. Good. And put your hands out like this. I want you to just move your wrists.
Okay.
Good. Good, good, good. Okay. Now I'm going to do your legs. I want you to push against me. Good. Good. Okay. Good. And I want you to push against my hands with your feet. Flex them for me. And underneath. Push down. Good. Okay. Now I'm going to test for sensitivity. I want you to close your eyes for me, and I'm just going to place this cotton ball in various places, and I want you to tell me when you feel it, okay?
Okay.
And where you feel it.
Okay.
Close your eyes.
Cheek. Nose. Chin.
Alright, and just tell me if you feel any of this.
Shoulder.
You don't have to tell me where, just tell me if you feel it.
Oh, yes. Yes. Yes.
Good. Now I'm going to test for sharp and dull sensations. Okay, and I want you to tell me if it's sharp or dull, okay?
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good. And then I would test for vibration sensations by using a tuning fork and hitting it and then placing it on the big toe. You felt the vibration.
Mm-hmm.
And then also, this is where we perform the monofilament test on the foot as well. So now I'm going to test the deep tendon reflexes. I would start off by doing the bicep tendon. I would find the bicep tendon with my thumb, and then strike my thumbnail, looking for the forearm to flex on either side. Now I would do the brachial reflex. I would find if you'll just put your hand like this, yeah, and relax. I would find the brachial tendon, and then test for reflex. The forearm should flex, and the hand should supinate. Now I would check the tricep tendon. So I would come behind my patient with my non-dominant hand and just relax. Just relax all your weight in that hand. I'm going to find the tricep tendon and strike tendon. And flexion of the elbow should be seen, so patient should make a movement as such as that. And then I would test the other side. And then now I would test the patellar tendon, which is on the knee. I would find the patellar tendon and hit it. The leg should extend for reflex, and then I would test the Achilles tendon. would hold my patient's foot up and or put it in a dorsiflexion position. Right above the ankle is where the Achilles tendon is, so I would hit that. And the foot should should be in a plantar flexion. What did you say? And I'd perform that on the other side as well. At this point, I would make sure my bed is at the lowest position. Head of the bed is at patient's comfort. 3 bed rails are up. Call light is within reach. And ask my patient if there's anything else I can do for them. And then I would take off my gloves and foam out.